Well, welcome to the show, Leslie. It's such a pleasure to have you here.
Thank you.
Let's start by learning a little bit about you, about your education or your background and where you came from.
I've been in the medical field for a little over 20 years. I managed a billing company for durable medical equipment for over 10 years in Greer, South Carolina. Before that, I worked in pharmaceutical clinical trials. I was a project manager for over 8 years in New Jersey. And I recently relocated to Wilmington over a year ago and worked in mental health, and now I've relocated to Navant.
Wow, got a lot of experience there.
Yes.
And some different, all health related, but just all different things. That's great. Well, let's talk about your role at the hospital. What is it that you do at Brunswick Medical Center?
I am the manager of the Patient Access Department. We do all registrations for outpatient procedures, inpatient admits, the emergency room, and any surgeries. So we'd register the patient, gather their insurance information, and make sure everything's in the system so they can have their procedures done.
So basically, everybody that comes to the hospital to be either admitted or utilize our services come through your department.
Yes, they do.
That's a big responsibility. Well, how long have you been with Novant Health?
6 months.
6 months. Well, that's great. Now, our main focus today is for you to tell me about something new. I understand it's some kind of a right patient software, and then something about an iris scanner. I can't wait to hear about that one. But so let's start with the new technology being introduced at Novant Health. So
we will be installing digital cameras on every registration desk. When you come in for your registration, you'll have your photo taken and it will scan your iris at the same time. And that will link to your permanent medical record.
So it'll be done at each registration desk. There'll be a scanner.
There will be a digital camera, just looks like a digital camera, and we will take a photograph. And it will be at every registration desk and on our mobile carts that we can take into the rooms.
Oh, so like in the ER, because they do bedside registration,
Yes.
right? So it'll be on that. Well, tell me about this scanner thing. So how does that work? The camera just points at you and do it, or do you have to like put your eye up?
No, the camera
we
we just point the camera at you, we take a picture, and there is a scan that just scans your
At the
iris
same time?
at the same time. Patient does not have to touch any equipment. It doesn't hurt, and they won't feel anything.
They don't feel anything.
No.
Okay, so when they come back for like the next visit, what happens then?
When you come back for your next visit, we would just do a scan. We don't do a photo. We just scan your face, and it will pull up your medical record.
And so you know that you always have the right patient for the right procedure at the right time.
Yes.
And all that stuff. So that's what that right patient software is. It recognizes you. Well, I know they have that a lot of other places. I've seen it like on TV and different things, but typically they'll put their eye up against this thing. But
No,
that's
you
not
don't have to do
necessary
that.
here. And they don't feel anything.
No.
Well, tell me, why did Novant think that was important to implement this iris scan?
It's to increase our patient safety and our patient security, and there's the security of their medical records.
Well, the patient safety that you're talking about, tell me a little bit about that.
Is to ensure that when you come in, we do have the correct patient.
Because like two people could have the same name,
Same
right?
name, same date of birth. It happens all the time.
Really?
We want to ensure that, yes, we want to ensure that we are registering you under the right patient account, that you will be billed properly, and it also will help prevent theft of your medical records or fraud.
Yeah, I know a lot of times when you come into the hospital or you go to the doctor's office, they ask you the same thing, the same questions over and over and over. And I understand that's a patient safety thing, just to make sure that every time you change hands with a different tech or a secretary or whomever, they have the right person. And I guess with the iris scan, it's probably even more secure.
It's more secure, and the patient doesn't have to have another form of identification with them.
Really?
Once you're scanned the first time and you're in the system, you would not have to present any other identification after that.
Well, that makes it simpler. I think folks get tired of asking or having to provide their driver's license or
yes.
whatever. And is the insurance information in there then? So you would just like update it, just say if you change?
Yes, if you changed your insurance, we would update your insurance when you came in for your visit. But as long as all your information is the same, when we do the iris scan, it pulls up your full medical record.
Now, is Novant using the iris scanners in any other facilities?
Yes, all the Charlotte area hospitals
Like-
have gone live.
Like Presbyterian?
Presbyterian, they all started with the iris scan in July.
How's that working for them?
It is working very well.
And how do the patients perceive it? Are they,
They've only had 2 or 3 patients actually say no, that they didn't want their picture taken. One lady was because her hair was not fixed that day. But they haven't had a lot of patients say no.
really?
Once they've explained that it's for their security and to protect their records, they're very open to having their photo taken.
So they're bringing on all the other facilities once,
About every 2 weeks, a new hospital's going live.
and when might we expect to see that at Brunswick?
We will go live November 11th, 2013.
Well, that's just right around the corner.
Yes, it is.
Gee, I can't wait. But it won't happen until you come. You wouldn't call people in to
No.
do all that prior to, just as you're coming in for a procedure.
As you're coming in for a procedure or anything, when you're coming in, we will scan you, take your photo then, and update your record.
Now, I know you said that there have only been a couple patients who have declined having their picture taken. Has anyone declined the iris scan or said, I just don't want to do that? Or
Not to my knowledge. I've reached out to the other area hospitals that have gone live, and they said it has gone very smoothly, and they've really had, the patients have been very engaged in having their photo taken.
So what would the procedure be if they absolutely refused to do that? What would you do?
We would just say, okay, no one is being forced to have their photo taken. If they do not want to have a photo and an iris scan, that's fine, but when you would come in for registration, you'd still have to have those additional forms of identification so we could make sure you are the correct patient.
So there would still be safeguards in place to make sure you have the right patient with the
Yes.
right, but you would use the old methods.
Yes,
And so again, you say it'll be November?
November 11th.
Okay, and they'll be at all the computers, you said at all the individual registration computers, but I was wondering if would there be a kiosk or something otherwise?
We will have a kiosk in outpatient, but that is to make payments and to confirm appointments. They will not have an iris scanner on the kiosk, but that is where they can come in and make payments if a financial counselor is busy or a registrar is busy and they don't want to wait.
Really?
And if you just want to come in and confirm your appointment.
Oh, right there in the at the entrance to the outpatient.
Yes.
Oh, I didn't know that. That's great information. Well, you told me it's November the 11th, and so I'm excited about that. I can't wait. That's exciting information. So is there anything else going on, anything new going on in patient access that you want to tell us about?
Not at the moment. That's the biggest thing going on, and that's going to be pretty big for us the month of November.
Yeah, and then I guess electronic medical record may be the next thing.
That will be the next thing.
And that'll be coming before you know it.
The end of 2014, I believe.
Yeah, I'm excited about that one too. Well, thank you so much for being on the show today. It was a pleasure to meet you, pleasure to have you here, and I hope that you'll come back and talk to us about the newest piece of technology that comes down the pike.
Thank you so much.
You're
It was
welcome.
a pleasure being here.
Thank you.